He woke up and the world was spinning. The ceiling, the walls, the bed, everything around him turned in violent circles. Mark gripped the edge of the mattress, heart pounding, trying to make it stop. He thought maybe he'd stood up too fast. Maybe he hadn't drunk enough water, so he waited. But the spinning didn't stop. When he tried to walk, the floor seemed to tilt beneath him. By the time he arrived in the emergency department, he couldn't even stand without holding the wall. And when I looked into his eyes, I saw something subtle, but deeply concerning. I've been a doctor for over 15 years, and I can tell you, dizziness is one of the most confusing and sometimes most dangerous symptoms we see. The word dizzy means different things to different people. Some mean lightheaded, as if they might faint. Some mean the room is spinning. Others describe it as feeling off balance, like walking on a boat. And because it feels vague and strange, dizziness makes people anxious. They start thinking, is this my heart, my blood pressure, my brain? The truth is, dizziness can come from many places. The ears, the eyes, the heart, the nerves, even medications. But the key question, and the one I'm going to help you answer today, is this. When should you worry enough to go to hospital? Make sure you watch till the end, where I'll share a simple table with you that will simplify all of this, which you can save for future reference. And do remember to subscribe so you'll never miss my videos again. Let me start with Anna. She was 35, otherwise healthy, and every morning when she rolled over in bed, the room spun for a few seconds. It was short, intense, and always triggered by movement. That's a classic pattern of positional vertigo, or BPPV. Inside each ear are tiny crystals that help you sense movement. When those crystals drift into the wrong canal, your brain gets false messages. It thinks you're moving when you're not. The result? Brief, spinning dizziness, often with nausea, but it settles quickly when you stay still. It can come and go for days, but is almost never dangerous. In Anna's case, a simple head maneuver corrected the problem, and within minutes she was fine. If you recognize that pattern, short, triggered, and positional, you can relax. It's dramatic, but harmless. Now, Mark's story was very different. His dizziness wasn't triggered by anything. It came out of nowhere and just stayed, constant, relentless. He couldn't focus on objects. He felt like he was walking sideways. Every step sent waves of nausea through him. At first glance, it could still have been an inner ear problem, but something about his balance didn't fit. Even when he sat perfectly still, he swayed slightly, as if the room were moving on its own. That's a clue that the issue isn't in the ear, but in the brain's balance center. We organized an urgent brain scan, and it showed a small stroke in the cerebellum, the part of the brain that controls coordination and balance. Mark didn't have the symptoms people usually associate with a stroke. No facial droop, no speech problems, no weakness, just dizziness. And yet, his life was at serious risk. He was lucky. Because he came in early, we started treatment immediately, and he recovered fully. But I often wonder how many people stay home, assuming it's just vertigo or low blood pressure until it's too late. Strokes that affect the back of the brain, the posterior circulation, can be subtle. They don't always cause paralysis or slurred speech. Sometimes the only symptom is dizziness or imbalance. That's because the arteries at the back of the brain feed the cerebellum and brainstem, the control centers for balance, coordination, and eye movement. When blood flow there is interrupted, the world feels like it's spinning off its axis. That's why doctors get nervous when dizziness is new, continuous, and unexplained, because hidden underneath could be something life-changing. Now let me tell you about Sarah. She was 45 and had just recovered from a nasty viral infection. A few days later, she woke up with severe dizziness that lasted all day. Unlike Anna, hers wasn't triggered by movement. Unlike Mark, it slowly improved over time. Sarah had vestibular neuritis, inflammation of the nerve that connects the inner ear to the brain. It's miserable, but not dangerous. It causes continuous spinning that gradually settles over days or weeks as the brain rebalances itself. Her case reminds us that not all constant dizziness is a stroke, but it's impossible to tell without a proper assessment. And that's the message I want you to remember. Don't diagnose yourself. Just recognize when something doesn't feel right. Sometimes dizziness isn't from the ear or brain at all. It can come from low blood pressure, especially when standing up quickly or after dehydration, low blood sugar, often in diabetics, or those who've missed a meal, anxiety and panic attacks, where breathing becomes shallow and fast, reducing oxygen to the brain, medication side effects, especially blood pressure tablets or sedatives, heart rhythm problems, causing brief drops in blood flow. These causes tend to make you feel lightheaded or faint rather than spinning. They usually improve when you sit or lie down. So ask yourself, Does the room spin or do I feel faint? That single distinction helps doctors decide where to start looking. You should seek urgent medical attention if dizziness is new, severe, and continuous for more than an hour. You can't walk straight or feel pulled to one side. You have double vision, slurred speech, numbness, or weakness. You develop a new headache or neck pain with dizziness. You have risk factors like high blood pressure, diabetes, high cholesterol, or previous stroke. If in doubt, treat it as an emergency, because with strokes, time lost is brain lost. When you come to hospital, we start with simple things, checking your blood pressure, heart rhythm, sugar levels, and hydration. Then we examine your balance, coordination, and eye movements. If anything feels wrong or doesn't fit the pattern of a simple ear problem, we arrange imaging, usually an MRI scan of the brain. Most of the time, we find something minor, but every so often, those scans save a life. Mark's story had a good ending. After a short hospital stay and medication to thin his blood, his balance returned almost completely. He changed his lifestyle, managed his blood pressure, exercised regularly, and hasn't had another episode since. But I'll never forget what he told me as he left. He said, "Doctor, I nearly didn't come. I was embarrassed to bother anyone over dizziness." That's the sentence I want to erase from people's minds. You never bother anyone by getting checked. Because in medicine, the people who act fast are the ones we get to help. Dizziness can make people feel helpless. It's invisible. No rash, no fever, no clear sign to point at. Friends might say, "You look fine," while your world spins uncontrollably. So if you've been through it, know that you're not alone. Whether it's inner ear crystals or something deeper, dizziness is real and it deserves attention. I've seen people cry from fear, thinking they were dying, and walk out laughing once they understood what was happening. Knowledge doesn't just heal, it calms. Here's what I want you to remember. Most dizziness is not a stroke. It's often the ear, your blood pressure, or temporary imbalance. But when it's sudden, continuous, or accompanied by difficulty walking, vision changes, or weakness, that's the time to act fast. If your dizziness is brief and triggered by turning your head, it's probably benign. If it lasts, worsens, or feels completely different, get checked. You don't have to decide what it is, just don't ignore it. As a doctor, I've seen how easily people overlook small warning signs. Sometimes dizziness is nothing. Sometimes it's your brain's cry for help. If this video helped you understand your symptoms better, please consider subscribing. It helps this channel reach more people who might be silently worrying the same way you were. And as promised, here's the table which summarizes all that you have learnt in this video. Share it with your loved ones. You'll never know who it may help.